Thank you so much, Heidi. I just want to make sure, can everyone hear me? All right, great. I am extremely grateful to be one of the co-chairs of this series of workshops and to be able to introduce Dr. Erin Hennessy. Dr. Hennessy is the Dean for Research Strategy, an Associate Professor and Director of Child Obesity 180 at the Friedman School of Nutrition Science and Policy at Tufts University. As Director of Child Obesity 180, Dr. Hennessy and her team conduct innovative research through multi-sector partnerships and deep community engagement to address the complex drivers of child health and promote nutrition equity. Dr. Hennessy has significant cross-sector experience ranging from industry to government to academia and uses this perspective to inform her research. I am very pleased to introduce Dr. Erin Hennessy. Thank you so much.
And thank you for that warm introduction. It is a pleasure to be here today with all of you and an honor to be included in this workshop. So thank you for this opportunity. Next slide. Before I begin, I want to just briefly acknowledge our funders who have been supporting this work over the years and just state that these views are my own and do not reflect their views. Next slide. And also before I begin, I would be remiss if I did not acknowledge the work of so many that inform what I'm going to talk about today. First and foremost are our community partners. So our organizations and community change makers and their partners who have been part of this work over the years. These are amazing individuals and organizations that commit their time, energy, and whole self to help achieve child health equity through PSE change. I'd also like to acknowledge our Child Obesity 180 and Catalyzing Communities team specifically for their commitment, passion, and enthusiasm, and often patience that's needed to advance science and practice for community-led change. And of course, I want to acknowledge our other collaborators who have informed our scientific thinking and the work that we do on the ground. Next slide. So in today's talk, I want to just hopefully make a few connections between what Dr. Blank shared as the introduction to this workshop today and with things that were shared in Opus 1. So I will be talking more about our Catalyzing Communities initiative at Child Obesity 180 and this perspective of how we apply an integrated complex systems approach to plan and engage across sectors and settings. I'm going to build from a presentation given by Dr. Christina Economos during Opus 1, where she had shared a bit about our Catalyzing Communities work overall and really hopefully further some additional key points that we'd like to make as a result of this work. Because I only have 20 minutes, I'm going to try to streamline this into 4 key points that I think are really important to this conversation. Next slide. The first is around sort of the elephant in the room, or the word that we use termed obesity. So I think first and foremost, I think it's really important that we really kind of step back and reflect on our understanding of the complex drivers of obesity and how they've evolved over time and what that means from a community perspective. And so with our communities, we work deeply and closely with them to ensure that the work that we're doing and championing on their behalf to make community-led change reflects their views. And many of them face many challenges. I think we've experienced lots of shifts over the past several years, especially in light of the COVID-19 pandemic and the rising increase in food insecurity that we've seen in the US and other factors that are going on globally that affect what we are able to do and not do here in this country. And so to that point, some of our communities partners really kind of point to the fact that while obesity is still important to them, it may not always be the sole focus or the most significant problem that they need to tackle, yet the root drivers of those problems and of obesity specifically are really important, especially as it relates to working toward achieving health equity. The other point related to this concept and how we've kind of shifted our views around obesity-centric language to the concepts of healthy child weight and health equity are to really think about the assets and aspirations of the community and shift to asset framing rather than solely focusing on the challenge or the problem. So how do we do this as it relates to how we plan and engage with our communities? Next slide. So this is a schematic that was shared in the Opus One workshop, and it really kind of takes a linear approach to sort of detailing the way in which we approach our communities. And it's really important that we step back and think about, if we want to achieve PSE change, what does it take to do that? And it takes really the people on the ground in the field every single day trying to make that change possible. So we work really explicitly and intentionally with what we call our change makers, so core partners, and we find it really important to train them in the area of systems thinking, in part because we now know from the shift in science over time that our perspective on obesity has become far more robust, and that it is a complex problem, and complex problems require solutions that are adequately tailored to them. System science and systems thinking is one of them, and I'll talk a little bit more about how we apply that in this work in a bit. And we convene that group who really is in charge. So they're often backbone organizations leading other multi-sectoral partners who are brought into the fold to participate in systems thinking with the goal of trying to increase their knowledge and engagement around PSE change. We all see the world in different viewpoints, and bringing them together to kind of share their thoughts and perspectives and their mental models is really important and powerful to be able to align in, on shared goals and values and create a shared agenda together. That work, that commitment that happens within often coalition meetings or however you want to call these groups that really are working together collaboratively to make this change, they form network connections, either informally or formally, and they interact with one another on these topics. And then they go out into their own organizations in the community, and those organizations then reach children and families and collectively influence those PSE change. So there's quite a bit of work that needs to happen to be able to get to that PSE change. And I think a lot of the work that we've done really well over the past couple of decades since I've been in the obesity science space has been identifying the what are the evidence-based practices that we need. And what we have been doing is trying to shift to the how. How do we get communities to be able to diffuse, disseminate, and implement those solutions so that they can have the downstream outcomes that we want to see in terms of health outcomes and health impact. Next slide. So our approach is what we call a theory-informed approach, and we do it and follow a 4-phase process. So the first phase, as I was just mentioning, is really understanding the system and really bringing forward the lived experience of the community partners and their expertise and what they know from their vantage point as community experts as to what is going to work in their context and what is sort of creating the system that is causing challenges so that we can identify specific leverage points. And we do that with our change makers and the multi-sectoral group, and we follow a process informed by community-based system dynamics and group model building activities. And again, we're trying to elicit and share the mental models of how people view the problems that they want to change in their community. We inform this along the way with evaluation metrics that help us to collect, analyze, and use data to understand the influence that these people have who convene these groups and lead these groups toward PSE change around their changes in knowledge, engagement, and networks over time. And we may also introduce some types of network intervention strategies to help strengthen stakeholder group ties. So we can look to see which groups or which sectors are connected to others or disconnected, and how can we build bridges to allow information flows and resources to move forward. We move to the second phase, which is process to action, and we're really infusing the evidence base so that our teams are aware of which strategies could be the most impactful. And we work together to help develop and share communication materials and insights, and really make sure that we're setting these groups up well to know how they can get their work off the ground and sustain it moving forward. So we're always planning for sustainability, even though we see phase 4 as sustainability. As scientists, we're often, always focused on evaluation, but what we've seen from our work over the years is that this is really important data and metrics that the community partners need to further amplify their work, success begets success. And when we start to see visible results, then other people want to buy in and can sort of make this whole engine continue to flow forward. Next slide. And this is informed our approach and our thinking through this report that came out. Now it's been 6 years, it's hard to believe, from the FSG Institute, and it's called the Water for Systems Change, and it really reflects the 6 conditions of systems change. Hopefully this isn't new to many of you on here, but I think where we have been really hyper-focused recently has been on our policies and practices and resource flows for good reason. We know structural change is imperative to make to be able to change the tide as it relates to obesity. But that structural change is driven by things we often don't see further down in the system. And those things are power dynamics, relationships and connections, and I've already alluded to the mental models that we all have and our viewpoints of how we think that the world works. And sharing those and aligning those is where we can really gain momentum to accelerate the progress around PSE change. And I want to acknowledge a new publication that was led by our postdoctoral scholar and early career investigator, Dr. Travis Moore, where we're trying to understand how perspectives and systems thinking shift in these coalitions or multi-sectoral groups and what's really needed to help drive that engine. Next slide. So that leads me to the second point that I'd like to make is that as our understanding of the complex drivers of obesity have evolved, we are shifting in the levels at which we try to intervene. And I think Dr. Blank did a nice job of sharing that perspective and how that has shifted over time. So obesity science as a field has moved from individual to more multi-level and now systems perspectives. We also are looking toward different approaches that we use to understand and address complex problems. They need to be matched with solutions that fit. And so we're now working toward more comprehensive cross-sector sustainable approaches as opposed to single one-off isolated types of approaches. We'd like this work to be, sort of at the center of community engaged with expert-driven solutions. So the communities need the evidence base to be able to inform the work that they're doing, and community experts share their expertise to know what is going to fit in their context. We're also thinking about the questions we're asking and how we're seeking to answer them. So we've already mentioned the great work of Dr. Shriki Kumanika, who has been a part of this council and part of this planning committee. She has been an advisor to our Catalyzing Communities initiative over the years, and we are proud partners of the Council on Black Health. I bring them up because they have done an incredible job of really shifting the conversation around health equity and an equity-focused action research agenda. Next slide. So in terms of the how-to, how do we go about planning and engaging? I think it's really important to acknowledge the Getting to Equity and Obesity Prevention Toolkit that is available to everyone for free on the Council on Black Health. I'm sure many of you are aware of it, but what I want to further is sort of some of the tools that maybe not as apparent that have been deeply influential to our work here at Child Obesity 180. Next slide. So within the amazing Getting to Equity framework, there was an appendix called the Tool for Rating Research Proposals or Programmatic Approaches for Sensitivity to Equity Issues. So this was framed as a tool to kind of review grants and applications to see how well or not aligned they were with trying to further the insights and data that we needed to help understand how we get to health equity. But this tool is far more flexible and dynamic than just simply rating research grants. We have internalized this tool into our own work to really ask ourselves the hard questions of, is our approach actually the approach that is going to help us get to health equity? Are we committed and are we doing the work that we need to do that to champion this effort? So we have taken this and really internalized it and worked with our community change makers to help set up our values and really frame the way in which we work with communities. So I want to just give an explicit example of that on the next slide. So if we think about the sensitivity tool questions, which takes you through kind of the structure of what a grant would be in terms of background and significance, your aims and hypotheses, your study design, et cetera. we went through every single questions and made adaptations for how we work in catalyzing communities. So we were trying to really be intentional in that shift. And I highly encourage anyone who hasn't spent time with this tool to go to the Council on Black Health website and take it and really understand it and really ask themselves the hard questions of, is the work that you're doing really going to help you answer the health equity questions that you want to tackle? Next slide. So you can go to our website, and we use this tool to then develop our commitments to equity. And this again frames the way we plan and engage with multisectoral groups in our work. And this is not a static document. This is organic and something that has been developed with our community partners. It's being maintained with them and will be constantly updated in partnership with our communities as we reflect on our progress and our challenges in this space. Next slide. So that leads me to key point number 3. I think the Getting to Equity Toolkit and the appendix and tools that support it have been really helping to expand the toolbox that we all use. And that toolbox really also needs to include things like workforce development, trainings, resources, and collaborations. Some of the things that have been influential to us as we have worked to try to integrate methodologies to drive innovation and meet the needs of this ever-evolving field have been, as I mentioned, the book Community-Based System Dynamics and trainings that I was fortunate to take when I was at a fellow at the National Institutes of Health. It was called the Institute for System Science and Health. And now there's a version of that that lives on at WashU. And there are also resources available. So we can't all become experts in everything. So you have to think about your partners in this space and the tools that you're building and how open and accessible they are. So I just want to acknowledge the great work of the System Dynamics Society that provides a lot of good group model building tools, which is the main methodology that we use with our multisectoral partnerships that really kind of helps you understand the process by which you engage. Next slide. Okay, so what do I mean by an integrated complex systems approach? We often know that one tool isn't going to meet the needs for a complex problem like obesity. So we've been working to really understand not just what evidence-based interventions, but how to get them into the hands of community partners and implemented and disseminated throughout the community. And so we're drawing from different methodologies such as agent-based modeling, systems mapping, group model building, and social network analysis. And the social network analysis piece has been growing. So we have been using it embedded within our agent-based model to understand the individual characteristics of the people who are at the community working toward this PSE change, to understand how their knowledge and engagement diffuses between one another. And now we're using it in a different way through network interventions to be more intentional, to kind of build those bridges between sectors and settings. And it's been an extremely useful tool. Next slide. So I've mentioned our community partners, and I want to acknowledge their great work here. You can see that, as I mentioned, as we've expanded our scope from just being sort of obesity-centric to a broader lens on how we help achieve healthy child weight and work toward child health equity, the commonalities across communities are clear, but also the significant differences based on their priorities, their geographical location, and the challenges that they face. So just want to acknowledge we do have publications with our community partners that are that you can read and learn more about the work that each of our communities is doing. And we're continuing to publish on that work. Next slide. So this brings me to my last key point number 4, and this is not new for anybody who's working in the field, but I have to give attention to it, that we have longstanding challenges and we need to work to become more resilient. So there's always been challenges in doing multisectoral, cross-sectoral work with community partners, such as turnover, right? So you work and you build capacity of a person or individual in a particular organization, and then they take a new job or leave. What happens at that point in time? How can we think about structural barriers to academic community research partnerships to help better support PSE change? We have a lot of conversations and work really hard here at Tufts to reflect on our institutional policies and practices with respect to payment and reimbursement models, community partners need to get paid, and they shouldn't have to wait the time that it often takes for universities to pay them to be able to support their work. And I encourage other funders to think more intentionally about some of these structural challenges to how research actually does and doesn't operate well in this space. I think there's always an ongoing tension in the scientific drive for rigor with feasibility required for community practice. A lot of times we're looking at PSE change and want to understand impact, and the way in which we might need to approach it from a scientific perspective can often cause significant burden on our community partners in terms of administrative requirements and the need for additional communities to come to the table. So we really want to always think about the value that we're adding to communities around PSE change as it relates to building science. And if we can't add value, then I question whether we should be at the table at all. Next slide. So this is just to acknowledge, that these are not new issues. So this is a systems map that was mentioned in the Opus One workshop that we developed based on the Shape Up Somerville intervention that was conducted in 2002 to 2004. And really, we wanted to understand how that intervention actually was successful. And that was really where we identified and leaned in on that coalition, that multi-sectoral group that was at the table. And if we look closer into the different subsystems, you'll see some of the things that I've already talked today about the fact that there's always going to be, some type of attrition, political changes, resource inconsistency, these challenges that really interfere with the flow for a particular multi-sectoral intervention. And that creates conflict and creates sort of tension around the coherence of action and influences PSE change. So what can we do to address some of those longstanding issues and become more resilient to these known challenges? So next slide. I think this is my last slide here. Just want to just summarize some of the key points that I made throughout this presentation and leave you with the thoughts of really kind of thinking intentionally about this word obesity and making sure we're shifting to asset-based framing, how we can think about different perspectives and be more explicit and operationalized using and applying a health equity lens, not just talking about it conceptually, but actually doing it explicitly in our work. Integrating different methodologies. They don't all have to come from complex science, but I think the example we gave here is well matched with the problem that we're trying to address. But to do this and to expand this work and to imagine what the next 5, 10, 15 years looks like, we need far more training in workforce development to build the field. And then lastly, really thinking about how we can build capacity of organizations and think about systemic structural changes in our own institutions and funding mechanisms to help further and drive this work. So with that, I want to thank you. I know I'm over time, so I appreciate having that space to be a few minutes over, and welcome any questions you might have. So thank you.
Erin, thank you so much for that amazing presentation. While you were speaking, there were quite a few questions that already came in, and I want to encourage anyone who is online to feel free to send additional questions, but I'm going to start with a few questions that already came in. Erin, so you mentioned that training community partners on systems thinking at the outset. Can you discuss this further? So give us some examples, tell us how it's operationalized. And then I think another similar question came in is just where are our change makers trained in systems thinking? You talked a little bit about the academic training. How do we get more people trained in systems thinking, and where does that come from? So sorry for those all of those questions at once. So discuss the systems, the training community partners in systems thinking. Give us some examples.
Great, sure. Yeah, and that is sort of the foundation of our work at Catalyzing Communities. And when we first started, doing this work, and we took from the script of community-based system dynamics and group model building, we ourselves became trained. And so we had staff who went to training, such as those that were offered by WashU, to understand both the systems thinking perspective and the actual way in which to conduct group model building activities. And so we built our capacity and realized, if we continue to do this, we're never going to leave any communities better off. So we kind of shifted from us being in the lead to that, to really trying to work intentionally with those 2 to 3 change makers. And so we, expose them to these materials, but we're providing ongoing technical assistance and support. So in the beginning, it's more us facilitating and then shifting over time to co-facilitation to the end, where the community change makers have the capacity, knowledge, and skills to lead the sessions in and of themselves. And so we don't abandon anyone or leave them along the way. A lot of times the communities that we're working with are coming with us to kind of tackle one specific problem and develop a causal loop diagram and a set of action plans from that causal loop diagram. So the need to go back and create another causal loop diagram isn't necessarily where a community is 1 to 2 years out. It's more about tracking and ongoing sort of progress and monitoring toward the change that first causal loop diagram helped to oversee. And I think we filled that need of trying to train our change makers, where we've had institutes and we've brought them here to Tufts and we've gone to them and have worked, closely with them through technical assistance and ongoing support. But there's a real need for our workforce amongst our community partners. I think systems thinking in and of itself is fairly new in public health. I think schools of public health are starting to have courses in systems thinking, et cetera. And in the interim, we can partner and help fill gaps, but I do think there's an opportunity for funders to, step forward and step up here to help fill the gap in training and workforce development in that space.
That's great.
And you can go to our website to learn more about our process. And we do plan on updating our website to share the scripts that we use. So we really want to make sure that this is easy for others to be able to follow, so you can see and understand for yourself, like, what does it actually look like to convene a group for 2 hours to develop, diagrams that are going to, understand a complex system.
Excellent, thank you. I have another really interesting question here that I'm curious to hear your response on. So what happens when community partners want to address different issues than what the public health experts or researchers or whomever are thinking about? So you go in and you're really interested in, obesity, although we can change the language around obesity. What happens if community partners say, that is not an issue, this is our issue?
Sure, yeah. I think you should listen. Like, why are they saying that is an issue and what you're saying isn't an issue? I think sometimes as academics and scientists, we question whether the community partner is not understanding the evidence base. And sometimes I think we should step back and say, perhaps we don't understand enough about the context. There can be a mismatch in those two things. And what is really important to the process that we have is that we're sharing mental models of our viewpoints and having those conversations about, well, if you think this happens, why is that? What is the actual flow here of this action results in this type of outcome? Mm-hmm. And we're also infusing the evidence. So we provide a lot of information about what we know right now in the context of obesity science. And what I would say is, we don't have a lot of good science around some of the ways in which to change structural drivers that we can actually inform and infuse. I think we're building that evidence now, but we have some good evidence as it relates to certain types of specific interventions. And I think those were highlighted in the Opus 1 workshop around different tax policies and other types of built environment interventions, et cetera. I could go on. So first and foremost, I think really check your bias about who you think is right and what is most important at the table. And then the whole process of sharing mental models is to bring sort of some cohesion and coalescing around what we know and don't know and what will fit in a specific context, and then moving forward from that direction.
Great. One more question. Can you talk a little bit more about how the Catalyzing Communities evaluation metrics are developed? Are there core metrics across sites, opportunities to sort of co-design these types of metrics with other people in the field, et cetera?
Yeah, Great questions. So what I would say is our beginning metrics of knowledge and engagement of the change makers, which might seem sort of superfluous to others, but we feel are really important and core, because you can't get to PSE change unless you have the people at the table in the community who are doing this. And we know from a long history of community psychology and community-based participatory research that there are individual and group dynamics at play that feed into that. Our work and that of others really informed our focus on knowledge and engagement in social networks, and we drew from valid, reliable measures to create our own instrument in the field and in the space. We have that work as published on our website, but we're drawing from the community-based participatory research logic model and tools that were developed to help explicate and measure change in those specific constructs. We've done a lot of reliability and validation work to develop that tool, which is not constantly, but is continuously being refined. And we welcome input from others on how to improve it. And that's sort of at the change maker level. The harder place has always been around measuring and tracking PSE change. We don't know at the start the interventions that are going to need to be unfolded in the community. So trying to understand how we can track and measure those types of metrics. So again, we're pulling from existing tools that are in the field now and working with our community partners to understand the feasibility of that data collection, where existing data lies in the community that we can draw from, as opposed to requiring a heavy burden on metrics and evaluation. So what is the data that exists that the community partners can continuously use to track progress and monitor change over time? So it's a combination of metrics across the different phases of the intervention.
Got it. I think we have time for one last question. Although there are many more that have come through, so maybe you'll get some follow-up questions.
I'd love to, yes, thank you.
Can you talk about how you think about sustainability and sustaining research when working with communities? What happens when the research ends?
Right. Oh, there's been so many things about sustainability.
Yeah, this one is not an easy one.
Yeah, it's not. And I because it's a term that means a lot of different things, right? And so I think understanding what are you trying to sustain? When we, I think, began this work in obesity prevention, it was trying to think about how we can help communities identify those evidence-based interventions that will be naturally sustainable, right? So policy changes that hopefully stay enacted over time, and other types of interventions that become embedded in the fabric of the community versus sort of one-off types of approaches that cost money, but they have to have a constant fuel of money to keep going. So I think we've always tried to design for sustainability in that space and think about capacity building so that we're leaving our community partners with tools and knowledge and capabilities to further the work when the research period ends. I think the greatest example of that is the work that Dr. Christina Economos spoke to in Opus One, and that many people might be familiar with, the Shape of Somerville intervention. And again, that was using evidence-based policy and environmental change strategies rather than individual level behavior change strategies. And it was really intentional at the start of that grant that there were funds that were being used and flowed directly to the community to embed personnel in the community that would then be taken up by the community. So actual literal positions and human beings that made the transition from the sort of the research workforce to the community workforce. And so the project manager of Shape Up Somerville, the intervention, became the project manager for Shape Up Somerville, the community program. That's not always possible, but thinking about where you have bridge people who are sort of crossing that divide between research and practice, and how you can use budgets to build the gap, because as you build the evidence and make the case that a community should have a budget line for this particular FTE, there might be a gap. And can you use the funding that you have more flexibly to bridge that gap to further sustainability?
Excellent. Thank you so much. I think that we're at about time, and I get to turn it over to you to moderate the next panel. So thank you so much, Erin, and I'm going to turn it back to you for the next panel.